Well, thank you everyone for joining us today. My name is Kelly Moltzen. I'm one of the conveners of the Interfaith Public Health Network, along with Bob Pezzalezzi. And the Interfaith Public Health Network, or IPHN, seeks to engage and mobilize faith communities to improve public health policy and programs. Essentially, we seek to inspire people of faith to be agents of change in transforming communities into ones that promote health and well-being for all. We are also a member of the Faith and Food Coalition, which brought faith-based organizations from around the world together in 2021 to contribute to the UN Food Systems Summit. We believe food systems have an important role to play in transforming health, environmental sustainability, and local economies, and of course, reducing hunger and food and nutrition insecurity. As IPHN, we know our faith traditions hold a lot of wisdom regarding humans' relationship with the earth and with one another, and so need to be an integral part of this work. Towards that end, we have led programs enabling faith communities to learn about food systems and identify areas where people in local communities can make an impact to improve food sovereignty and access to nutritious, affordable food for all. We've also mobilized faith communities to advocate for food policy changes to increase transparency of nutrition information from the food and restaurant industries. With the support and resources provided by Food Systems for the Future, which you will hear about shortly, we organized a faith dialogue informing the White House Conference on Hunger, Nutrition, and Health in September during Climate Week New York City as part of the Buddhist Tu-Chi Foundation's Holistic Climate Solutions Summit. We submitted our recommendations from that dialogue to the White House, leading to conversations with the USDA and this session. The USDA is interested in hearing from faith and other community partners. So as you are listening to Dr. Bleich today, please feel free to introduce yourself in the chat and share what you and your organizations are doing to improve access to healthy food for communities across the country. And with that, I will pass it over to Elizabeth Ebboat, who is the Director of Communications and Policy at Food Systems for the Future, to speak briefly about the Good Food Dialogues process. Elizabeth?
Thanks, Kelly. So at Food Systems for the Future, we support and invest in scalable food and agriculture enterprises that are capable of achieving nutrition impacts in underserved and low-income communities. Ahead of the historic White House Conference on Hunger, Nutrition, and Health, like Kelly mentioned, Food Systems for the Future launched the Good Food Dialogues, an online platform and forum designed to first bring together diverse stakeholders with a vested interest in addressing food insecurity and diet-related diseases like IPHN. Next, capture their experiences and ideas for ending hunger as we know it. And finally, share their perspectives with the Biden administration to help inform a new federal food policy strategy. So Good Food Dialogues was grateful to partner with the Interfaith Public Health Network and Kelly and the team here, whose participation really highlighted the actions and solutions for improving health equity coming from and generated from within the faith community. So now as we shift our focus post-White House conference to events like today and certainly more actions to come, even from Food Systems or for the Future and Good Food Dialogues, FSF looks forward to our continued collaboration with IPHN and our future collaboration with USDA as we work to mobilize a multi-sector commitment that supports food as a fundamental human right. So next, I'd like to introduce Samantha Joseph. She is the Senior Advisor for Faith-Based Initiatives at the USDA Center for Faith-Based Neighborhood Partnerships, and she will give an overview of the USDA's approach to collaboration with faith communities and introduce Dr. Bleich. Thank you.
Thank you very much. And hi, everyone. It's so nice to be here with all of you. I am new to USDA in the role of leading the Center for Faith-Based and Neighborhood Partnerships. So we're very much in listening mode, looking to meet with all kinds of faith-based and other community organizations who are doing work in the space so that we can understand how we can best serve you. So I definitely encourage people who would like to follow up to put their information in the chat, and I will schedule some follow-up calls after this. But for now, we're really excited to have this conversation, to hear what's most important to our faith partners, and to continue to be in relationship with you. I'm really excited to introduce Dr. Sara Bleich, who is going to provide the bulk of today's conversation and what USDA is doing in this space. So Dr. Bleich is our Director of Nutrition Security and Health Equity in the Food and Nutrition Service at USDA. She's previously a Senior Advisor for COVID-19 in the Office of the Secretary at USDA and is a policy expert and researcher who has done, amazing work in this field. And we're really lucky to hear from her. So Dr. Bleich, thank you for joining us.
Thank you so much, Samantha. Great to be with you all. And I also want to especially thank Kelly and Elizabeth, who helped make it possible for me to connect with you all in the Interfaith Public Health Network. So what I want to do in the next 20-25 minutes or so is give you a brief overview of the food and nutrition security work we're doing at USDA and its intersections with health equity and structural racism. And then I'll talk about how USDA is working very deliberately to advance food and nutrition security, including how we're leveraging the recent White House conference and the corresponding national strategy. And I did have a chance to read the notes from your meeting back in September and all the different ideas you had across those 3 different pillars. So just really appreciate the enthusiasm and the creative ideas coming out of this group. So let's start with the focus on food insecurity. This is an issue that USDA takes the lead on monitoring for the country. And this past fall, the Economic Research Service, which is an agency at USDA, published the nation's annual food security report, which found that 33.8 million Americans lived in households that struggled against hunger in 2021. Now, this is a sobering number, which many of you are trying to reverse or at least slow down in all the work that you're doing. But I want to also flag that the report did include some good news. So compared to last year's report, the number of Americans experiencing food insecurity decreased by 5 million. And food insecurity among households with children was at a 2-decade low, which is tremendous. And the annual report suggests that one possible reason for this progress is how the federal nutrition assistance programs and the critical additional investments that we've been making during the COVID-19 pandemic, how all that together has helped to combat hunger. Now, these investments include USDA's historic reevaluation of the Thrifty Food Plan. This is the thing that serves as the basis for calculating SNAP benefits. I'll say more about this in a few minutes, but briefly, it resulted in a 21% increase or $36 per person per month in average SNAP benefits. And this is a critical change for putting healthy food within reach. That food security report also highlighted that disparities still exist. So for example, Black and Latinx households are disproportionately impacted by food insecurity. In 2021, the rate of food insecurity among Black households was almost 20%. It was about 16% among Latinx households, and that's compared to about 7% among white households. Now, without question, COVID-19 brought the vital need for access to healthy food right up to the forefront. And as you all know well, COVID-19 is also associated with a whole bunch of diet-related diseases and disparities. So there's one study that shows that nearly 2/3 of COVID-19 hospitalizations in the US are related to 4 diet-related conditions: obesity, diabetes, hypertension, and heart failure. But critically, disparities in food insecurity and diet-related diseases didn't start with COVID. They are long-standing problems and associated with decades of structural limitations to retail food outlets that sell healthier foods. And these disparities are rooted in other longstanding historical inequities in things like education, employment, housing, and other broad social factors. And we also know that health disparities start early. So if you look at Black and Indigenous children, they are more likely to have overweight or obesity compared to their white counterparts. Now at USDA, we recognize that structural racism harms health in ways that can be described, that can be measured, and that can be dismantled. We also recognize that confronting structural racism requires not only changing individual attitudes, but also transforming policies. So we at USDA are looking very carefully at our policies to identify ways to incorporate health equity and to address the social determinants of health. And it is worth saying, it is significant that as a federal department, we are acknowledging structural racism and not pretending that we can solve it, but using it as motivation for all this work that we're doing in the food and nutrition security space. One example I want to highlight within rural settings is the Rural Partner Network. That's an alliance of federal agencies and civic partners working to expand rural prosperity through job creation, infrastructure development, and community improvement. And community priorities are often aligned with the social determinants of health and include things like affordable housing and workforce development, access to healthcare, broadband, and the list goes on and on and on. And for the first time, the White House has established an interagency policy group focused on the social determinants of health. So please keep an eye out for work coming out of that group. Now, while the federal government is bringing increased attention to social determinants of health, we are also calling attention to the fact that poor nutrition spans all demographics. So we know, for example, that poor nutrition is the leading cause of death in the United States and responsible for more than 600,000 deaths per year. And poor nutrition and diet-related diseases have far-reaching impacts beyond health. So that includes decreased academic achievement, increased financial stress, and there are also broader societal impacts: reduced worker productivity, weakened military readiness, and skyrocketing healthcare costs. Now, since launching our Food and Nutrition Security Initiative this past March, USDA has come to define nutrition security as meaning that all Americans have consistent and equitable access to healthy, safe, and affordable food that is essential to optimal health and well-being. And there are two core motivations for this evolution. The first is the promotion of health equity, which means everyone has a fair and just opportunity to be as healthy as possible. And the second is that structural inequities make it hard for many people to eat healthy and be physically active. One of my key messages to you all, who many of whom have worked in this space for a long time, is that with this focus on nutrition security, we are not abandoning our decades-long work at USDA on food insecurity. Instead, we are building on and complementing it with this additional focus on nutrition security. Essentially, we are just widening our aperture. Now, before we dive into how we are working to advance food nutrition security, I do just want to give a quick overview of some of the relevant equities that we bring to bear. First and foremost, we have a suite of more than 15 nutrition assistance programs at USDA, which together serve 1 in 4 Americans over the course of a year. And these programs aim to provide children and income-eligible people with access to safe, nutritious, and equitable food, along with nutrition education and promotion resources that promote healthy eating. These programs have broad reach and reach tens of millions of Americans, including more than 41 million Americans through SNAP, the Supplemental Nutrition Assistance Program, more than 30 million kids each day through the National School Lunch and Breakfast programs, nearly half of all infants in the US through WIC, Women, Infants, and Children, and this is at about 99,000 schools and 250,000 retailers. Now, in addition to the nutrition assistance programs, we also invest more than $1 billion per year on nutrition education and promotion efforts across all of our programs. And another key thing we do at USDA is translate the dietary guidelines for Americans through MyPlate and by a broader investment in research and food systems. So with that background, let's focus on how we at USDA are advancing food and nutrition security. And I'll try to highlight where this network can be helpful. To start, let me say that if you want to learn more about what we're doing, please take the time to go look at our Food and Nutrition Security webpage, which is updated regularly. I have often found that government websites can be hard to navigate. So our Nutrition Security page is meant to find in one place everything happening at USDA that relates to the work that we're doing. And again, it is updated regularly. Now, all of the work we're doing on food nutrition security is scaffolded by 4 pillars: providing meaningful nutrition support from pregnancy to birth and beyond, connecting all Americans with healthy, safe, affordable food sources, developing, translating, and enacting nutrition science through partnership, and prioritizing equity every step of the way. I previously was a public health nutrition researcher before coming to USDA, and I'm really proud about how all of our work is driven by research and grounded in science. In fact, it is woven into our policies, it informs each of our decisions, and most importantly, it impacts every life that we touch. So again, if you want to learn more, really encourage you to explore the report that we put out about our actions on nutrition security and our web pages, which go in much more detail about the work that we're doing in this space. Now, another important thing to know about our work is that it is driven by the lived experiences of our staff, of our stakeholders, and our participants. And that actually includes me. So I grew up in inner city Baltimore. I have a twin sister and an older brother. This picture is me and my siblings. So I'm on the left, my brother's in the middle, my twin sister's on the right. This was taken at the old Memorial Stadium, which is where the Orioles used to play. It's about a block and a half from the house that I grew up in Baltimore. It's where my parents still live. It's where I learned how to ride a bike. And when we were little, our family received SNAP, which was then called food stamps. We received WIC for a period, and also school meals. And every time that I go home, which is pretty frequently, so I've got two little girls that are 9 and 11, and I take them home quite often. We'll next be there for Christmas. I am reminded about the importance of the work that we do at USDA to make sure that families are fed and fed well. And every time I go to work, I think it is such a privilege to have the opportunity as someone who's a recipient, a past recipient of these programs, to make them even stronger. And right now, we have a window of opportunity, from the president to the Secretary of Agriculture to other cabinet leaders to senior officials across government. There is so much interest in promoting nutrition security and racial equity, and we need to take advantage of this moment. So I'm thrilled that so many of you are already doing so much in the space to try to advance these goals around food nutrition security. So let me take a few minutes and just say a word about each of the pillars, starting with that first one, which is meaningful support. And I'll focus in on the bullet, which says ensuring benefits are adequate to support healthy eating patterns. And as you'll see on this slide and subsequent slides, each of these pillars has subcomponents underneath of it. So in October 2021, and I've already talked about this a little bit, but I'll say more about it now, we were charged by Congress to reevaluate the Thrifty Food Plan. Again, that serves as the basis for the SNAP calculation. This reevaluation increased the purchasing power of SNAP benefits by 21%, or $36 per person per month. This was a game changer. It was the first permanent increase in the Thrifty Food Plan in 45 years. So very, very significant. Another thing that's important to know is that SNAP is designed to adjust for inflation. So at the start of this past fiscal year, October 2022, the SNAP benefit increased by about 12.5%. That is one of the largest inflationary increases in the history of the program. And what this means practically is that this fiscal year, a family of 4 who receives the maximum SNAP benefit will get $939 per month. Now, the next pillar is healthy food. As you can see, it has 3 sub-pillars underneath of it. I want to focus on using incentive programs to promote access to healthy eating. An example of our work in this area is how we administer a program called the Gus Schumacher Nutrition Incentive Program. And just for background, there are 3 other incentive programs that we administer at USDA, which I won't take the time to go through today. But on GusNIP, between 2019 and 2022, the program provided about $270 million in funding to more than 170 projects throughout the United States and its territories. In the second year of GusNIP, participants redeemed more than $20 million in nutrition incentives. And importantly, participants reported increased fruit and vegetable intake and improvements in food security. So very promising findings. And then in June, as part of the Food System Transformation Framework, Secretary Vilsack announced nearly $40 million more to support GusNIP using funding from the American Rescue Plan Act. The third pillar is collaborative action. It has the 4 sub-pillars that you can see here. Want to focus in on updating and building the evidence base for dietary guidance. A key collaborative action in this area is how we at USDA work collaboratively with the Department of Health and Human Services to regularly update the dietary guidelines for Americans. They are important because they serve the basis of federal nutrition policy, education, outreach, and food assistance to reflect the latest nutrition science. And the 2025-2030 edition of the dietary guidelines will be released by the end of 2025. And we aim to announce the Dietary Guidelines Advisory Committee in early 2023. So stay tuned for that. I do also want to highlight a collaborative program I hope each of you know well, which is SNAP-Ed. We have recently made some critical changes to SNAP-Ed, including for the very first time in the history of the Food Nutrition Service, we have a new nutrition education branch in SNAP to support SNAP-Ed. We've improved data collection. We've established a national license for the Program Evaluation and Reporting System, or INPAIRS, and we are encouraging, through guidance, maximum flexibility in the use of policy, systems, and environmental change approaches, which are one of the most evidence-based behavioral approaches to improve healthy eating and physical activity. Now, the fourth and final slide is equitable systems. Fourth and final slide is equitable systems. It has 5 subpillars. With the first one is where I want to focus: strengthening support to Native American tribal school food programs. And the example here that I like to talk about is how USDA's Office of Tribal Relations recently launched the Indigenous Food Sovereignty Initiative, which promotes traditional foodways, Indian country food and agricultural markets, and Indigenous health through foods that are tailored to American Indian and Alaska Native dietary needs. And just a few weeks ago, USDA released new resources and new agreements to support this initiative. And to do this, USDA is partnering with tribal serving organizations on these projects to reimagine federal food and agricultural programs from an Indigenous perspective and use that to inform future USDA programs and policies. So just one example of a new resource is there's now a user's manual for interested ranchers to transition from cattle to bison. Bison is a very important protein, for example, for Native populations. There's also a new agreement that USDA will partner with new foragers and new chefs to create additional recipes and videos on foraging and cooking Indigenous foods. And that work will focus on the Northeast and Southeast regions of the country. So now let's switch gears again and talk about how we at USDA are leveraging the recent White House conference to advance our goals of food and nutrition security, while helping to accelerate progress on the goals of the White House conference, which are to end hunger, improve nutrition and physical activity, and reduce diet-related diseases and disparities by 2030. Now, during the development of the conference, I have to say, we were blown away by the enthusiasm. Like how I reacted to that really impressive set of notes that I received from your September meeting, we were blown away by the enthusiasm for participating in or hosting listening sessions, attending conference planning calls, sharing ideas through the website, and making significant commitments towards helping us drive towards the conference goals. And for me personally, one of my favorite parts was the chance to connect with colleagues and hear all the excitement, many folks who I hadn't seen in person in about 3 years. It was also very energizing to hear the more than $8 billion in non-federal commitments to advance the conference goals. And then another memorable part of the day for me was just the opportunity to connect with dozens of individuals who currently have lived experience with the nutrition assistance programs. Their expertise is so informative to how we can think about driving toward an even stronger suite of federal nutrition assistance programs. So now let's talk about the national strategy that was released the day before the White House conference. It includes input from more than 20 federal agencies and thousands of diverse voices around the country. It is meant to set us on an ambitious and achievable path to achieve the conference goals. And you can see that the strategy is anchored by 5 pillars, which are listed here. Now, for the sake of time, I won't go through everything in the national strategy. I'm guessing many of you might have had a chance to look at it, but I just want to run through some of the key actions for USDA. And one of the most critical ones is healthy school meals for all. We know this is a shared goal with many of you here today, and acknowledge the essential role that each of you play in helping us vision of healthy school meals for all. And let me just say a bit about why. So elevating school meals is a key strategy to improve our nation's health, and it would benefit all children. It would also significantly strengthen the school meals program for those children who rely upon it most. As I mentioned, national school lunch and breakfast programs provide critical nourishment to more than 30 million children each day. This not only improves kids' nutrition, but it's also been shown to support academic performance. So the pathway to healthy meals for all children that's outlined in the national strategy would reorient the school meal programs from being an ancillary part of the school day to instead being an integral component. So much how we think about books and desks and computers. And some of the essential parts of this approach are expanding efforts to increase access to local and regional food systems, enabling more schools to cook from scratch by funding training and equipment purchases, investing in the school nutrition workforce, and expanding nutrition education for children. The Biden-Harris administration will take the first major step toward this goal by working with Congress to expand access to healthy free school meals for 9 million more children by 2032. And this network and each of you as individual members can help educate Congress and other key stakeholders on the importance of healthy school meals for all. I do want to highlight another opportunity for you all, which was included in the national strategy and is currently open to public comment. And let me just take a step back first and give you the context. So a few weeks ago, USDA put forth a proposed rule to update the WIC food packages. This is only the second time this has happened in the history of the WIC program, so it's a pretty big deal. The proposed changes aim to align the foods provided to WIC participants with the latest nutrition science and have potential to support equitable access to nutritious foods during critical life stages. As you all know well, WIC has a tremendous history of improving health and developmental outcomes. So we know, for example, WIC participation results in fewer infant deaths, fewer premature births, and increased birth weights, and it also reduces healthcare costs. In my current role at USDA, I really enjoy working with many stakeholders on strengthening the public health impacts of WIC, among many other programs and equities at USDA. And again, as a former WIC baby, it's really nice to have the opportunity to work on a program that helped me and my family when we were growing up in Baltimore City. I do have a chance to go around the country and visit WIC clinics. And one of the things that I hear is how WIC has such an impressive reach. And it does. It serves more than 6 million women, infants, and children in an average year. That is just under half of all infants born in the United States. But the challenge is that is only 1 in 2 people eligible for WIC. So part of my effort has been calling on folks like you to think about how do we ensure that we can reach millions more. Without question, when we move the needle on increased participation and improved nutrition in WIC, we can expect to see meaningful impacts for millions of families. And importantly, the changes that we have proposed not only reflect the latest nutrition science, but they also make the program more attractive to current and potential participants. So the ask is that this is a proposed rule for comment. So we are seeking feedback and just encourage you to submit a comment. You have to do that by February 21st. Now, in the weeks, months, and years ahead, the White House and all of us at USDA look forward to working within and outside of government to ensure successful implementation of the national strategy. At USDA, we released a highlights report the day after the conference explaining how we plan to leverage the historic event to really promote and elevate nutrition security. So if you haven't read the report, really encourage you to do so. It explains who we are, who we serve, and it highlights our key work underway. And just to summarize, here are just a few things that we have in the pipeline. There are many other actions that are not listed here, but when you put them all together, we expect that they will improve nutrition for tens of millions of Americans. So I wouldn't be doing my job if I didn't leave you all with some asks. So I mentioned already the importance of commenting on the WIC proposed rule. Do encourage you to do that. But I also just encourage you to keep thinking about how you can step up and lean in, because even if it's small, it can all add up and make a meaningful difference. And so I just want to flag 3 areas where your efforts would be particularly useful. The first is helping to ensure that all who are eligible participate in the federal nutrition assistance programs. Our data at USDA indicate that only about 1 in 5 people eligible for SNAP participate. Now, most SNAP benefits are redeemed, so we are talking about people who would receive small benefit amounts, but these are dollars left on the table that would help people. So we need to make sure those are maximized. As I mentioned earlier, only about 1 in 2 eligible for WIC participate. We are pushing hard on this area using funds provided by the American Rescue Plan Act of 2021, and we hope to make significant progress towards improving WIC participation, but we cannot do this alone. So appreciate your help in this area. And then finally, our data show that only a fraction of the children who participate in the school lunch program during the year also participate in the summer meal programs. The second area where we could use your help is getting the word out. We create a lot of materials at USDA and have many more in the works. You all are trusted messengers and can help us go the final mile in reaching people that we are trying to serve. So the example on this slide is that we have a specific campaign about back to school. The reason is that back in the summer, the special authority that USDA had from Congress to offer all children free meals at school expired. And so what that has meant is that in September, families have to submit an application to determine if they qualify for free and reduced price meals. This was a big confusion point. Many families did not realize that they had to do this. And so your help in disseminating this message, which is still current, you can enroll at any point during the school year, and other important messages coming out of USDA are really going to be helpful to us. And then finally, is I just really appreciate the opportunity to be able to have a discussion with you all in a few minutes. It is so helpful to know what you're doing, both the areas of success and the pain points. We take that information back into our conversations at the national office. We also share that broadly as we go around the country, but it's very, very helpful for us to understand what is working and what is not working. So let me just wrap up with a heartfelt thank you. You all have already done so much work that has led us up to this moment, and I have no doubt that you will be very much involved in all that is to come. So just really appreciate the effort that you have already put in. You know, the primary message that I heard from the national strategy is that the problems of diet-related diseases and disparities are almost entirely preventable, but they will take a whole of country approach. And so just look forward to the opportunity to lean in with you all and think strategically and critically about how do we drive toward both food nutrition security, but also the goals of the White House Conference. So let me stop there. Really appreciate your attention and happy to take any questions.
Thank you so much, Dr. Bleich. That was very informative and inspiring to see. So I think some people have started putting some introductions in the chat, as well as some questions. I'll take this one question, and then I do want to call on a couple other people, but since there's a question in the chat here, this question from, I believe it was Diana Blackwell, who is, she's running she's just been given a space to open a pantry and become a partner with the food bank and City Harvest, and wondering how she could partner with the USDA Food and Nutrition Program.
Well, Diana, that's a great question. So I would say two things. One is that we have the way that we are structured at the Food Nutrition Services, we have the national office, and then we have 7 regional offices. A great way to plug in is to reach out to the deputy administrator in your regional office. It looks like you are in New York. Yes. So for you, that would be Lizbeth Silverman. And we're happy to, if you want to reach out and email me, I'm happy to make that connection for you. But that's a good way to begin getting involved with the regional offices, which can then tap you into some of the national resources. But I think the bottom line, one of the things that I have learned from being at USDA, it is very permeable to the outside. We are looking for ways to work with partners, and we don't just say it, we mean it. So I would say for any of you that are doing important work in your area, think about connecting with the regional office and then looking for ways to then connect with the national office so we can share your learnings and what you're up to with other partners around the country. But it's a great question.
Awesome, thanks. And Rebecca Johnson, I was wondering if you would want to share a few words about your work.
Sure. Hello, everyone. Thank you, Dr. Bleich. This is really, you're right. This is a key time, and I'm really inspired and really happy to be part of this conversation right now. A lot of my work has been in New York City public schools, in school kitchens and school cafeterias for about 10 years. And just recently working with an organization called Plant Powered Metro New York, which does adult education. So the focus has really been nutrition education from the start. And so one of the things that, you know, has been a challenge is, yes, we were a PS24 in the Bronx, woohoo. We have often been educating children and in the classroom and in the cafeteria about the food that they're getting every day. And now you probably all know there's this initiative, which is actually through Wellness in the Schools where I was, to have chefs in New York City provide recipes to DOE. The children will taste them, they'll vet them, and they could potentially go on the menu. the key here is that it's plant focused. So we, chicken nuggets or whatever it is, we know they're going to get the animal protein, but it's the vegetables where we see a lot of the nutrient density. And so when we're talking about the essentials of nutrients and nutrition, we really do need more of those vegetables. So one of the things that I was just thinking in listening to you and what I know about nutrition education and how it's building is educating those who actually work in the kitchens and work with the food that they are giving to students. It's not just the culinary aspect. Many of them may have culinary background or not. So a big part of it, we can all know how we eat. We like food to look a certain way. We like it to be consistent. And these cafeterias are I always say they really are the children's cafeteria. But also that connection between what is in the food, what the food is, how it benefits the body, the difference it makes. And I find that those who are working with the food also need to be included in this nutrition education initiative.
I feel like I should give you an amen or a here. I could not agree more. So a couple of thoughts. One is you are 100% right that it's really important to think in brass tacks and say, there are folks that are preparing maybe 100,000 meals a day or 10,000 meals a day, whatever it is. It's reasonable that they should have training in how to do that in the healthiest way possible. There are some school districts who are very forward-leaning in that area, and there's some which need a little bit more support. At USDA, we have a program called Team Nutrition, and it provides technical assistance and ideas and resources, but it's small and it's not enough to do everything that you're talking about. I think as we think about this pathway toward healthy school meals for all kids, a key target is going to be educating the folks who are making the food, as well as creating kitchens that are supportive of that work so that you can actually do scratch cooking. Another key piece of it, though, is making sure that there are school food service directors that are really leaning into this effort. There are some districts that don't have school food service directors. So I think that it's an excellent point that you're making. And I noticed it when I travel around. I had the opportunity to visit a school in East Harlem. And then that looks different than a school in Providence or a school in Chicago. And so I think that it's remarkable the different exposures that children have, and they're all under the same set of guidelines. And so what that tells you is that leadership at the local level, as well as the folks who are preparing the food, their roles matter immensely. So I think you're raising an excellent point, and I think there's amazing stuff happening in New York City. So it's great that you're a part of it.
Thanks. I want to take Daryl Harris has a question, and then I know there's some others in the chat as well.
Yes, thank you. Thank you, Kelly, and thank you, Sarah, for being here. I have two questions. One is I work for the Center for Livable Future at Johns Hopkins University. I used to work at Johns Hopkins. I know CLF very well. Okay, wow. Okay, well, whenever you want to come back and talk to us, we're here for you.
Very good, but I interrupted. I apologize.
No problem. No problem. So one of the things that we've been doing is working with faith groups, and so we've developed a few curriculums that are nutrition based that we've been working with faith groups around Baltimore, the Baltimore region, and so I wonder if there's any interest of that beyond Baltimore. And then the second thing that I have a question about is, we do a lot of health equity research. A lot of research based around the first couple of slides that you shared in your presentation. And I'm wondering if there are any significant gaps that a group like us could go and fill to help fill out the picture and answer some questions that are currently unanswered.
Cool. Those are big questions. All right, let me take the first one first. So in terms of thinking about how you're connecting with nutrition services with faith-based groups, and could you build that out in other parts of the country? I would say for sure, and it seems like this network is the right way to think about how you might do that and amplify it and try to get it in different parts of the country. So I would probably leverage this partnership to make that happen. To your second question, obviously CLF is very strong on the research side. What are some of the gaps? So I would say, and part of this is there are data limitations out there, but there's a lot of gaps in terms of who participates in different programs. So who participates in SNAP, who participates in WIC. One thing that I talked about was that participation is not maximized, but it's also true that that differs if you're Black or you're white or you're Native American or you're something else. Some of that data is available at the federal level, but I would say on the area of participation, understanding what the key barriers are for different race ethnicities for whom poor participation is an issue is one important research area. I would say another is there have been so many waivers that were put in place during COVID. There are so many critical questions that need to be answered, some of which will happen on the federal side. Like, for example, what's been the impact of the Thrifty Food Plan on the diet quality of purchases? Like, these are some important questions to ask. But at the same time, we need to have a better sense of, do these policies differentially impact different populations? So there's so much data that's being collected at Hopkins across a whole wide range of topics. And I would say one thing you all might think about doing is pulling together researchers who might have existing cohorts whose time periods span the pandemic and seeing if there can be secondary analyses to look at it wouldn't be cause and effect, obviously, but the association between different policy shocks that happened during COVID and various outcomes like diet quality, like BMI, things that we really have a lot of questions about, but for which we don't know the answer. And I actually think the research community could step up big in that area because there's a ton of data out there. It's just not all being leveraged to answer some of the important questions that have bubbled up in COVID.
And just to jump in, I'd love to follow up with you on the idea of connecting with faith-based leaders, across the country. That's definitely something that we're doing at our center and convening faith leaders, more broadly. So I think that would be great, and we'll follow up.
Okay, there's so many questions. It's hard to identify what to ask. I want to ask one from Miriam, and then Steve, I see your hand. We'll get to you. Miriam's asking, can you speak to the issues around USDA funding subsidies like WIC, but also to agribusiness, and then also setting nutrition standards that can be influenced by these subsidies?
That's a good question, Miriam, and it's got a lot of different pieces to it. So just for background, USDA has a very broad portfolio. About 70% of our portfolio goes towards the nutrition assistance programs that we've been talking about, but we also do farming, we also do firefighting, and we also do rural America. So there's a whole lot of different things that we do. One of the pieces that Mariam is lifting up is that we do a lot of work with agricultural businesses. And then on the food side, we have the WIC program, we have nutrition standards in schools. And so I would say that these are all very important priorities at USDA. With respect to the food side of the house, that is driven by science. So for example, as we update the WIC food packages, that is driven by the latest dietary science. As we look in 2023 to update school meal standards, that will be linked to the latest dietary guidelines for Americans. So I think it's worth repeating that everything we do at USDA is driven by research and it is grounded in science, while at the same time, we have a very broad portfolio that touches, frankly, like every aspect of American life.
All right, thanks. And Steve, I see you have your hand up. Would you like to ask your question?
Yeah, hi. Thank you very much for taking this time. And I want to say, just looking at the participants, I know a lot of these folks, and this isn't a team, so you're talking to some great folks. I'm out in California. I'll make a comment and then I have a question. So the comment is, we were a Finney or GusNIP grantee working with lots of sites in California to help get CalFresh, we call it, or SNAP, and with SNAP incentives at faith-based sites. And I'll just say it was very, very challenging to help congregations be able to get us a license to accept EBT. And we worked with the highest levels of FNS, and I have to say it's there's a lot of things I can blame the Trump for, but this is pre-Trump. This was, in the Obama administration. So there's some structural barriers that make it hard. But here's my question. We saw, you're talking about racial equity and food security. Sometimes we've seen a tension between the two. And I think during COVID, the folks here on the phone, many of us know like Heber Brown's team said, hey, we are not going to take free food from one set of farmers when we're working hard to support the income of Black farmers so they actually, said no to some donations of food through USDA and raise money to purchase it from Black farmers in North Carolina and other places. What other models are you seeing like that, where people are, there's no silver bullet, but what models are you seeing that are hopeful to make sure that we're supporting underserved farmers while we're getting food to people?
Yeah, so those are great point and great question. To your point on just structural barriers around SNAP, there's obviously not time in this conversation to go into the nuances, but if it would be helpful, we're happy to connect you with our SNAP team that can talk about, like, there are some challenges built in statute about who can and cannot be a SNAP retailer, the extent to which, you're running into like the same issue over and over again. It's just helpful for us to know what that is. So I'll stick my email in the chat, but feel free to reach out if they can make that connection. To your point about lifting up opportunities for Black farmers, I would expand that to say BIPOC folks in the workforce in general. And so I'm less familiar with the farming side, to be totally frank. And I would say that one really interesting model that I recently observed was in Chicago. The West Side is the poor side of the city, and they are doing a huge amount of work around food and food security, economic mobility. One of the things that they found is that to open a business on the West Side of Chicago, for example, I think there's like a $25,000 minimum. So the city is thinking about waiving that as just one example of how do you help people in meaningful ways to actually enter into whatever the particular ecosystem that it is. On the USDA side, we are doing a lot of work to support Black farmers. There was recently an announcement that I can put in the chat, which sort of describes that effort. But I think the bottom line is there's a lot more that could be done. There are very few Black farmers left in this country. My grandpa was a Black corn farmer. And so, how do we preserve that? How do we maintain it? How do we make sure that folks have the resources that they need? USDA is definitely making historic efforts in that area, but there are more that could be done. And I think that generally there's an interest in how do we support BIPOC entrepreneurs, but we can't just say it, we got to do it and do it in ways that are meaningful. So just really appreciate the question.
Thank you.
Thanks. And I know we are going over time a little bit. Do we have time for like maybe another question or comment or two?
Sure.
Okay. Nuria, would you like to ask your question?
Thanks. I'm Nuria Parrish from Plainsong Farm in Greater Grand Rapids, Michigan. And I was just curious about how USDA partners with faith communities who are growing and giving vegetables, because there's a lot of that happening at the small scale, and often those communities are not aware of the importance of cultural fit for the population they're trying to serve. And I'm just wondering if there's a strategy yet from the Faith-Based Neighborhood Partnerships Office to engage faith communities more intentionally. And if not, how can we help?
Can you repeat the first part of your question again? I didn't totally catch it.
Sure. So I'm curious about how USDA partners with faith communities who are growing and giving vegetables with the goal of health equity and increased nutrition security. There's so much of that happens kind of under the radar, small scale, not reported to anybody anywhere, and not necessarily connected to a government program because of historic separations between church and state. And so often, with the best intentions in the world, churches grow food and then they can't figure out how to get it to people who actually would want to use it, and they're growing food that's not necessarily a fit for the population they're trying to serve. With the intent that they have and the land that they have, it seems like it would be possible to develop a strategy to make this more effective. And is there a way that faith leaders can help with that?
Yeah, that's a great question to which I do not know the answer. I want to pull in Samantha to see if she might know the answer to that question.
Not at the moment, but I'd really love to have a follow-up conversation so that we can go into that.
Me too.
But I would say, so I don't know, one thing that we have to sort of get to the bottom of is what is the role that USDA is playing and can play. But I think the other piece of this is, what can happen outside of USDA in the faith-based community to build up a network where leveraging the farmland to create produce that folks in the community want to eat. Like, obviously you have to give people what they want, but it has to be farmable on the particular land that you have. So I think it's an excellent question, and we can certainly follow up with what exists and what's happening at USDA already.
All right, I know that we are over time. There are several questions that I know we did not get to in the chat. Is there anyone else, if you have a burning question you want to ask right now, you want to raise your hand? Otherwise, we can maybe follow up afterwards and answer the questions that have been in the chat. If not, I know we want to respect your time, so we're 5 minutes over. So thank you so much, Dr. Bleich. It's been a pleasure having you here with us today. We're really excited to be having these conversations with you and the USDA, and look forward to seeing how we can continue to follow up and be in touch.
And thank you all. Great discussion, great ideas. Sorry we couldn't answer all your questions, but we'll do better next time.
All right, thank you all.
Thank you.
Thank you.